My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that? Stabilization of postprandial glucose levels with semaglutide for weight loss GLP-1 is an incretin hormone secreted by intestinal L cells in response to food intake. Semaglutide mimics this natural hormone, enhancing its physiological effects, including promoting glucose-dependent insulin secretion, reducing glucagon secretion, and slowing gastric emptying. These actions are pivotal for controlling postprandial glucose spikes. Semaglutide activates GLP-1 receptors in pancreatic beta cells, stimulating insulin secretion only when blood glucose levels are elevated. This glucose-dependent mechanism ensures insulin release is proportional to the body's needs, preventing hypoglycemia. Enhanced insulin availability facilitates the uptake of glucose by peripheral tissues, effectively lowering blood sugar levels after a meal. Glucagon, a hormone secreted by pancreatic alpha cells, raises blood glucose by promoting hepatic glucose production. Semaglutide suppresses glucagon secretion in a glucose-dependent manner, reducing unnecessary glucose output from the liver after a meal. This dual modulation of insulin and glucagon fine-tunes postprandial glucose levels. Semaglutide slows the rate at which food leaves the stomach and enters the small intestine. This action blunts the rapid influx of glucose into the bloodstream, smoothing postprandial glucose peaks. Slower gastric emptying also contributes to prolonged satiety, a benefit for weight management. By increasing insulin sensitivity, semaglutide improves the ability of cells, particularly muscle and fat cells, to absorb glucose. This reduces the glucose load in the bloodstream following a meal, promoting steady blood sugar levels. Semaglutide acts on the central nervous system, particularly the hypothalamus, to regulate appetite and reduce caloric intake. By limiting food consumption, semaglutide indirectly contributes to a more manageable postprandial glucose response, as smaller meals typically result in smaller glucose excursions. In individuals with obesity, insulin resistance is common, impairing the body's ability to use insulin effectively. Semaglutide not only aids in weight loss, which independently improves insulin sensitivity, but its direct effects on glucose metabolism further enhance cellular responsiveness to insulin, contributing to smoother postprandial glucose regulation. Chronic hyperglycemia and excessive postprandial glucose spikes can impair pancreatic beta cell function. Semaglutide has been shown to preserve beta cell function by reducing glucotoxicity. Healthier beta cells mean better regulation of insulin secretion over the long term. Weight loss achieved with semaglutide reduces adiposity, particularly visceral fat, which is strongly associated with metabolic disturbances and insulin resistance. As weight decreases, systemic inflammation also diminishes, further improving insulin action and glucose utilization. The combination of these effects contributes to more stable postprandial glucose levels. Clinical evidence supporting semaglutide's role in glucose stabilization. Several clinical trials have demonstrated semaglutide's efficacy in managing postprandial glucose levels. Reduction in glucose variability. Studies show that semaglutide reduces glycemic variability, including postprandial glucose excursions, in both diabetic and non-diabetic individuals. Improved A1C levels. Although hemoglobin A1C reflects average blood glucose over time, its improvement with semaglutide is partly attributed to better postprandial glucose control. Comparative studies. Compared to other GLP-1RAs, semaglutide shows superior efficacy in reducing postprandial glucose levels due to its longer half-life and stronger GLP-1 receptor activity. The stabilization of postprandial glucose levels with semaglutide offers numerous metabolic benefits. Reduction of cardiovascular risk. Large glucose excursions are linked to oxidative stress and endothelial dysfunction. Smoothing these spikes reduces cardiovascular complications. Prevention of type 2 diabetes. By stabilizing glucose levels and promoting weight loss, semaglutide helps prevent the progression to type 2 diabetes in high-risk individuals. Enhanced quality of life. Smoother glucose levels reduce symptoms like fatigue and hunger, promoting overall well-being.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.